Our areas of greatest need are continuing to grow. Some of them were pretty significant before COVID and have bubbled up, like hunger and homelessness. Mental and behavioral health are certainly areas that are kind of the tsunami is beginning. But Grace Clinic has been at the heart of making sure that there is access to healthcare. And for those of us who are blessed to have insurance, what does that mean to us? That means maybe some of our employees who were working part-time, who don't have access to healthcare, can be healthy and well as we rebuild businesses. It means that if you go to an emergency room, there may be fewer people in the queue because they had some preventative services through things like Grace Clinic. So the existence of Grace Clinic affects every person, even though they might not even yet know about it. And hopefully this will help more people know about the work you're doing. So as you look macro at our community, what are the top 2 challenges you see our community facing as we move forward to rebuild a better Mid-Columbia region than it was even before COVID?
You know, I think that at the top of that list is beginning to understand the new normal. Okay, because there are going to be things that are different long term. And so what does that look like? And that will be difficult. You know, if you think about some of the things that have taken place since March, since February, you know, this is a new disease. We know more about it every day, but early on we knew very little. And so our knowledge has continued to evolve. And the same thing is going to be true in kind of looking at what is the new normal. You know, how do we, because today we have no idea really what the future of COVID-19 looks like. Are we going to see a big uptick in the wintertime? You know,
how's it going to intersect with flu season?
Right.
Right.
And in fact, I was in a conversation here just very recently about the need to get vaccinated for flu, because we don't want to be confusing this. Okay. If you can avoid the flu, okay, that's a really good idea. Probably a more important idea than at any time in the past. And so, you know, figuring that out is going to be difficult. And then the related thing is avoiding politicizing it. Mm. You know, it's a real challenge, and we need to place some greater emphasis on the understanding that there are a lot of people working on this who are doing it strictly from goodwill, you know, who are, and you know, we need to recognize that none of this is easy. And so, you know, we're going to have to adjust. And so I think those are the things that, you know, we don't have any idea the job losses have occurred. How many of those are going to be more or less permanent? You know, what is going to, how many businesses have we lost that won't come back? And, you know, what does all that look like? And it's going to be tough.
It is, the new normal continues to evolve because every week is a new normal. Mm-hmm. As we figure out, you know, how to cope with what's happening and still focus on doing the right thing.
Right.
And I think that we're very blessed in the Mid-Columbia region in that we have so many nonprofits who are working with our public officials and the health department and the cities and counties to really figure out, you know, what is the right thing for us to do for now, given what we know, and how can we support each other so that we can do more because we know we're doing more with less. And that's probably part of the new normal as well. Mm-hmm. But, you know, it is amazing to, you know, just see how your organization has pivoted. You know, as you said, staying open, you've been doing this as a gradual pivot. to really help continue to serve people who've lost their insurance or who didn't have insurance, so they can be a productive part of our community and reduce, you know, the potential impacts of chronic diseases, which adds up cost and loss of labor time. It's a significant investment. Mark, I just appreciate your leadership. This is something you're doing because it's a passion of the heart. Again, you're a volunteer executive director of a pretty significant nonprofit. I know you invest an amazing amount of time, not only in that nonprofit, but others. So thank you. And thank you for what Grace Clinic continues to do as a key part of the wholeness and the future of the Mid-Columbia region. Do you have anything else you'd like to let people know about Grace Clinic?
You know, I think the thing that is probably the most important for people to know is that while we've been doing this for a while, you know, we're 18 years old now. We've been able to grow into meeting a significant part of the need, and that is because of our community. It is because of the people who step up to make it happen. It's because of those that support us financially, and it's because of organizations like United Way. United Way has been an important partner to Grace Clinic from the very early days, and you know, our community is better because of all of these things. And you know, at United Way, your leadership, LoAnn, is critical. And you know, if we roll up our sleeves, if we focus on doing the right thing, you know, we can make this a better community.